quite intense that it needs to be, in many cases, can be very, very hard because we have to, scare the system into trying to adapt. Right. And that takes a big impetus. It takes a big stimuli.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
One of the things that I've seen are these graphs of recovery after stroke over time, and that, well, Jonathan is now what, at 3 years, right? Was 2018. And I guess earlier on is when you get the most bang for your buck in terms of therapy, but over time it's less return for a given amount of therapy. I guess, and one of the things that I guess can be challenging is, Jonathan would like to think, oh, well, if I do this for a month, I'm going to see a change, and I'm going to, things are going to come back. But I keep telling him it's not that easy, or it takes a lot to come back, and somewhere along the way, I'm kind of rambling, but I'm guessing that's or saying or feeling that, or what is it they call it, plateau?
Sure. Yeah, the concept you're talking about is this plateauing effect. And I think it's really important to mention, and let me just acknowledge what you're saying. And I think the way you described it is almost how I described it too. So you're exactly right. And that is, early on after a neurologic injury, you generally can get more ROI. So like if you imagine like 1 hour of rehab can maybe get 10x of improvement, where X is just some arbitrary number. And then maybe a year after, we get maybe 1x, something like that. Those are just arbitrary things just for illustrative purposes, but that concept is true. Now, the thing that is often misinterpreted is that goes to zero, right? It doesn't go to zero. It just becomes harder to get those effects, right? It becomes a little bit harder to improve. So the truth of the matter is that when we are faced with a more, let's say, a chronic impairment, we have to be more strategic about how we deliver rehab. It needs to be quite intense, and it needs to be, in many cases, can be very, very hard, because we have to basically, to be very frank, we have to, scare the system into trying to adapt. Right. And that takes a big impetus. It takes a big stimuli. And so that being said, when we do find we have plateaus, and this is certainly possible, even with Motus hand rehab, even with any approach, there's the potential of having plateaus, pure and simple. But it's how we adapt, how we respond to when we observe a plateau. The wrong thing to do is to continue doing the same thing over and over and over again. The thing we have to do is we have to change the stimuli in a certain way to make sure that your system is basically surprised. Because what happens is, it's a very simple example is weightlifting, right? Or if you, for painting, for instance, right? If you were to paint the same thing over and over and over again, you might get good at something, get good at a technique, but then what has to happen, you kind of plateau and you kind of reach the limits of what you could do.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
What has to happen, you kind of plateau and you kind of reach the limits of what you could do. Then what has to happen is you have to choose something that's much more different, right? You do a different type of media, use a different type of subject matter to change the stimuli. And that would then help hopefully change the way your body's responding. You might be, get more ability to draw fine structures. You might get more inference about different color structures, these sort of things. And my original sort of example here is about weightlifting. If we go to the gym and we go in and we train to lift a 20-pound weight, and we do that for months, you're going to get better at lifting that 20-pound weight. But it's not like you're going to get better at lifting the 100-pound weight or get better at sprinting, for instance. We have to change the stimuli whenever you do plateau. And we may have to do that regularly with the Motus hand, I think, and that's okay. And the way we do this is we can turn a bunch of different knobs. We can make things more challenging in terms of the ranges of motion, the level of actual help that you're getting. We can also change this with the individual therapeutic exercises, right? We can choose games, even though you're moving the same amount, but if we make the requirements for you to move much more complex, right? If you're having to move with fine temporal dynamics, you have to kind of negotiate fine obstacles. That's going to be much more challenging for your brain to interpret. And it's going to be much more challenging for you to generate those movement patterns. And these are all the ways that we can kind of acknowledge that we're going to have a plateau and try to work around it and change the stimuli to keep you improving.
Is this why there are these variety of games on the for the hand mentor?
Mm-hmm.
You know, like space tennis, fishing, all these sort of things, to come at it with different approaches. Although in all cases, it's moving the wrist.
Precisely, yeah. But the thing you might notice is if you can look at the data and find a tail, some of them are very simple, right? Like the strongman exercise, for instance, right? This one doesn't have any sort of temporal constraints on it, right? You just have to, at some point, go to the down position and then go to the up position, right? That's a very simple case. But the one you mentioned, fishing, right? When you're trying to control the location of your green bar as the fish moves up and down, that's going to move at potentially random occurrences, and it's going to change directions very rapidly. Those two things, even though we're doing the same sort of motion, right? Fundamentally, if we boil it down, yeah, we're moving into this flexion of the wrist and the hand and extension of the wrist and hand. Even though we're moving in those same fundamental directions, the environments, the context of those movements are very, very different. And that's how we can use the games to sort of, leverage the visual complexity too, to kind of cause those stimulus to be constantly increased.
So, actually, fishing is not one of Jonathan's favorites.
Yeah.
You have all the use data. We're seeing on the screen here. Of how because there is the user has choice of which ones they want to engage with and others. I'll skip.
Yeah.
Jonathan, you like the one where it's breaking, your favorites are breaking the bricks and was it space tennis?
Cosmic tennis. Yeah. Yep. Those are really good ones. Yeah, those are really good ones. I'd say go ahead.
One that stuns me is the symphony with the music in one.
Sorry, Jonathan, I didn't hear you there. Did you say you like that one?
That's one that stumps me the most.
It stumps you the most. Yeah. So that's a great example, right? Because you have to move from potentially there is a music note at the very top, bottom, top again, or you have to go to the middle. So it can be very, very quick movements. And that's a really challenging one.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.